You are welcome to online lectures with From a Time to the Schoolboy. Today, we are going to take a look at pharmaceutical calculations. Pharmaceutical calculations. Okay, as usual, if you have any question, feel free to chat me or drop a comment on the chat section of this live lectures. Just go to the comment section, drop your question there. I'll see your questions and attend to your question. Feel free to do that. If I take any step you don't understand, please ask question. Okay, so we have a question on the board. As usual, this lecture is a problem-oriented lecture. We have to solve questions, problems in pharmaceutical calculations. Okay, so number one question for today says, okay, the question says, the starting dose of sodium oxybate oral solution is 4.5 grams per night. divided into 2 equal doses and administered 2.5 to 4 hours apart, how many milliliters of the oral solution containing sodium oxybate, 250 mg per ml, should be administered in each divided dose? Okay, let's look at this question again. The starting dose of sodium oxybate oral solution is 4.5 grams per night, divided into 2 equal doses. So in the night, the total dose that you take in the night is 4.5 grams per night. So now when divided into 2 equal doses, what it means is that if you divide 4.5, you get 2.25. So the patient takes 2.25 grams between these hours. So the first one, 2.25 grams, the second one, 2.25 grams. After like 2.5 hours or to 4 hours, you take another one, 2.25 grams. So the total dose per night is 4.5 grams. This is the dose per night. But the question now says that how many milliliters of the oral solution containing sodium oxybate, 250 mg per ml, should be administered in each divided dose. Now, if you look at this question, there are two things in this question. The first one is the dose of the drug. The second one is the strength of the drug. The dose of the drug has to do with the amount of the drug the patient needs to achieve a particular therapeutic purpose or outcome at a particular time. That's the dose. Why the strength is the concentration, how the drug is presented. So what they have in shelf is the one that solution that contains sodium oxybate, 250 mg per ml. That's the strength of what they have. But the dose is 4.5 grams per night. That is divided into 2 equal doses, 2.25 grams. That dose. Now, so a dose now is 2.25 grams because now this is the night. So there are 2 doses the patient need to take in the night. So a dose will contain 2.25 grams. Because if you divide 4.5 by 2, you have 2.25 grams. But the duration, the frequency, the interval is between, if you take the first one, 2.25 grams, give it about 2.5 hours to 4 hours to take the second dose, which is another 2.25 grams. So, but the strength is this. So they don't ask us to calculate how many meals of that particular product that will deliver this 2.25 grams per dose. So that is what this question wants us to do. All right, let's do it. Solution. So the per night, the dose is what? 4.5 grams per what? Night. That's the dose per night. Now, but in 2 divided doses. So if you now want to have it in 2 divided doses, that means a dose, it should be equal doses. So a dose now, dose per night. This should be what? The dose per what? Night is this. So, but in 2 divided what? In 2 divided equal what? Those is you have 4.5 grams divided by 2, which is what? 2.25 what? Grams. So the patient will take 2.25 grams per what? Dose. So the patient will take 2.25 grams per dose. 2.25 grams per dose. So if that is the case, you now go back to the strength. The strength of the drug, the drug in medicine is 250 milligram per what? Ml. 250 milligram per ml. This means that, by implication, this means that 1 ml of the solution contains 250 milligram of sodium oxybate. That's the meaning of this. Now, but the amount to be taken per dose is 2.25 grams per dose. So to solve this, we now, this is gram, this is milligram. We either move this 250 milligram to gram, or we move this gram to what? Milligram. So let's move this gram to milligram. 2.25. 1 gram is what? 1,000 milligram. Therefore, 2.25 gram is what? X. This is simple. Just cross multiply. 2.25 gram times 1,000 milligram divided by 1 gram. Gram will cancel gram. This implies that X is what? 2.25 gram times what? 1,000 milligrams all over what? 1 gram. Gram will cancel gram. 1 is insignificant. 2.25 times 1,000 gram. Decimal movement. This will take decimal point here. The second 0 will take it here. So we have only 1 0. This third 0 will put a 0 here. So 2.25 grams is simply what? 2,250 milligrams. So here is what? 2,250. Here is what? 2,250 milligrams is equal to S. 1 ml of the solution delivers 250 milligrams. So how many ml of the solution will deliver 2,250 milligrams? Because this is the amount per dose. So if you now multiply, you have that X is now equal to what? 1 ml times what? 2,250 milligrams all over what? 250 milligrams. So X is now equal to what? If you divide through, you have that this divide this. Milligram will divide milligram. We have 225 over 25. So how many 25 can we find in 225? 10 times 25 will give you 250. So 9, if you subtract 25 from 250, you have 225. So this should be 9. This is what? 9 ml. This is what? 9 ml. So 9 ml of this solution, sodium oxybate solution, will contain the what? 2.25 gram. So if the patient will simply take 9 ml from that solution that contains 250 milligram per ml, the patient will take 9 ml of it that will deliver 2.25 gram as a dose. Then after like 2.5 hours to 4 hours, depending, the patient will take another 9 ml. So taking total of what? 18 ml. So 18 ml will deliver this 4.5 gram per night. So the answer is what? 9 ml. The answer is 9 ml. So if you have any question, please feel free to ask. I'll give like 2 minutes before I end this class to ask your question if you have any. 2 minutes. If you don't want to comment, send it as a chat. You can call this number. This number 081 38 68 2003 070 1294 5891. Call any of these numbers. We have 2 minutes to go. The time is 11 minutes after 4. So, around 13 minutes after 4, I'll stop this lecture. So while we wait for your question, please subscribe to my YouTube channel. My YouTube channel name is Pharmaceutical the Schoolboy. Also follow me on Facebook. My Facebook page name is Pharmaceutical the Schoolboy. Follow me on different social media platforms like Instagram, Twitter, TikTok at Pharmaceutical83, and LinkedIn at Pharmaceutical. My name there is Pharmaceutical the Schoolboy. Follow me on AudioMark at Pharmaceutical-the-Schoolboy. Every Saturday, 7 a.m. to 7:10 a.m., I organize academic competition entitled Academic Battle with Pharmaceutical the Schoolboy. The academic competition is completely free of charge. You're not paying any money to register. We depend on donation from people to be able to get the gift. The prizes we give to the winners of the competition. Please, we need your support. If you want to make any donation towards that, please see the flyers. The flyers is all over our social media platform, even in this YouTube channel. Go to the community section, you see the flyer there. The title of the competition for tomorrow, being Saturday, 2nd December 2023, is Igbo Language Battle 2.0 with Pharmaceutical the Schoolboy. Please, if you want to participate, feel free. Chat me up on WhatsApp via any of these numbers. You will be added. You will be given a link on how to go about it. As I said before, registration is completely free of charge. Please share my videos, like my videos, comment on them, share with your friends, your relatives, your colleagues, your children, your students. Someone out there may be in need of these lectures. Every day from 2 a.m. to 5 a.m. I host live lectures ranging from basic sciences, specifically calculations in chemistry, calculations in physics, mathematics, then pharmaceutical calculations. For now, please avail yourself of this opportunity to be awake between 2 a.m. and 5 a.m. I must be here to give you values. Please invite your friends to join these lectures. God bless you. In the absence of any question, we'll end this lecture now. Hang around, stay tuned. We are coming back again live for another subject. In this time around is chemistry. In 10 minutes time, we'll be back live for chemistry lectures. God bless you.